Hi, this is Dr. Tom Rogers at Performance Medicine on your weekly podcast. I've got an interesting topic today to talk about, and that's Botox. Something we've been injecting for many years now for various reasons. I mean, Botox is not just a treatment for wrinkles in your face. It's also used for migraine headaches. It's a wonderful treatment for that. It's used for excess sweating, hyperhidrosis in the armpits, and also sometimes in the extremities. It's used for spasticity. I had a patient last week, as a matter of fact, that was had an unusual neurologic condition of one arm, and she was going down to Duke for one of the neurologists down there to inject her forearm with Botox. Very few people are doing this type of thing, but the point is that there's many uses for Botox, and I'm going to tell you a brand new one that they're researching that's very interesting to me, that it may be very helpful for, and that's depression. And it's not only the look good, feel good from it. There's a clinical reason why it does help depression. But what Botox does is kill the area between the nerve and the muscle. So when you shoot Botox, at least temporarily for about 4 months on average, you're making that muscle flaccid, and that's how it improves wrinkles on the face. You have to know your anatomy pretty well, but then you can become a great Botox injector all over the face, and there's even some off-label things that we do with Botox for cosmetic purposes. And one thing I will clear up, now that we're in COVID-19 and all, there's been reports that the vaccines, the two mRNA vaccines, may flare up the fillers. I've had many people ask me, does this mean if you get the vaccine you can't get Botox or so forth? And no, it does not apply to Botox, so you're safe there. And with the fillers, there have been some rare reactions between the COVID-19 vaccine and fillers like Juvederm and Voluma, and it probably applies to some of the other ones as well, like Radiesse and some of the other fillers that you read about. Volbella, there's a bunch of them. But and there is a possible sensing of that vaccine that's a foreign thing in your face and you get swelling. That's rare, but and it can be treated easily. But for that reason, a lot of people are just not putting fillers in faces. Now, I'm still putting filler in faces, but we'd ask you to not do it for 20 days after a vaccine, or if you're planning on getting the vaccine within 20 days, just delay your filler treatment for your face. But getting back to Botox, which is completely safe. As a matter of fact, it's one of the safest drugs ever studied in history. It was discovered really by a Canadian ophthalmologist who was trying to cook up some kind of remedy for one of her patients that had facial tics, and so she knew botulism toxin killed nerves, so she shot some botulism into this guy's side of his face, and it actually worked for the tic, for the spasm, and she also notices that it took the wrinkles out, and there for the Botox story. I wish I'd have thought of that. But in any event, but the interesting thing, so there's a lot of uses for Botox for various reasons. Periurethral spasm for incontinence, and there's going to be a lot of other things that we use it for in the future. But when I ran across this article about Botox helping depression, it really kind of piqued my mind, because we see so much depression, and we shoot a lot of Botox too, doing an anti-aging practice. But the thing about it, there's a very strong mind-muscle connection, and it's not just because of observational studies that this happens. I mean, they've compared it to other studies that can like improve migraines. And it seems that the Botox treatment for migraines help the depression much more than some of the other treatments that we have for migraines. So it wasn't just observational. It was actually some very good studies that have borne this out. We've used ketamine for depression before, and it certainly works. And it seems like Botox is the number 2 often studied neurotransmitter type substance in the treatment of depression. I've seen ketamine do amazing things. But so in this study, it's not just because you look better, and it's not just because it relaxes the muscles, although that may have something to do with it. But it seems like the brain connects with the muscles, and how your muscles feeling, your brain senses that. So when your muscles are relaxed, your brain senses that, and it's more relaxed, and sometimes your depression will lift just because of this. So there's a lot of ongoing studies about this, but when you think about the mechanism, it's not just the observational studies that have borne this out. So next time you come in and get Botox, see if especially in the winter, if you've got a little seasonal affective disorder, a little depression, see if your depression doesn't lift a little bit. Future studies are ongoing about this, but in my opinion, it's just another reason to get Botox to look younger and feel better. But the effects on depression are major, because depression is it's a chronic illness. It's very hard to treat. As you know, you can't be a family doctor for 35 years and not see people in your office every day who are depressed. That leads to real medical and physical problems. So next time you get your Botox, think about this. Just an interesting thing to me. I'll certainly keep my ears tuned to what's going to happen with this. So another reason to get Botox. Hope you guys have a wonderful week. We'll talk next week. Thank you.